having sinus problems. This could be because of a dental infection or an oral infection. Hi, my name is Dr. Rudra Mohan, and today I'm going to be talking about the connection between maxillary sinusitis and dental infections. Let's start. So I'm going to be first talking about two topics separately. That is, one is the maxillary sinusitis, although it is not a typical part of what we are taught in dental school. But then again, we are taught a major part of it as well because of the fact that the maxillary sinus is kind of connected to the oral cavity somehow, and it is a part of the facial skeleton. So the maxillary sinus is a pyramidal shaped sinus with its flow towards the nasal cavity, and it is a part of the paranasal sinuses. It helps in two functions. First of all, it helps in the making of the weight of the skull light because of the pneumonization. Secondly, it helps in the phonation. That means when you're speaking, if you put your fingers here, you can feel the vibration. So that also helps in you speaking. Now, a lot of times, a lot of patients come to the practice saying that I'm getting dental pain. And when we see and examine with radiographs as well as all the tests that we do for the dental origin of pain, we actually find that there is no such pathology ascribing to it. And that is one of the rare things where we see that it's the maxillary sinus that is causing a similar kind of pain because of the close proximity of the teeth to the maxillary sinus, that too of the upper jaw, the back teeth. Conversely, a lot of times we get patients who are having an actual maxillary sinusitis episode where there's nasal discharge and there's a lot of pain, there's a lot of headache, but there's no attributable cause. But when we examine the teeth are decayed or there's some sort of periodontal problem, and then we find out that this is a maxillary sinusitis of odontogenic origin. That means the cause of the infection was started from the tooth or the oral cavity, and then it communicated to the sinus. However, the percentage of these cases is 10 to 12%, but then again, the amount of population that we have, you can understand that 10 to 12% and the kind of discomfort that one person goes through, we have to understand that we have to diagnose the disease. Now, usual maxillary sinusitis symptoms are basically nasal discharge, headaches, and a blockage of one of the nostrils and congestion. So when you see this, and as a dentist, and if any dentist is watching this, and if you see that there is something that you can see that the teeth are already having cavities, and once you see the radiographic evidence that there is some sort of communication and there is some sort of radiographic evidence where we see that the sinus is kind of communicating or it is kind of in close proximity with the teeth, we can assume that it is a maxillary sinusitis of odontogenic origin. Secondly, let's talk about how to manage it. See, most of the maxillary sinusitis cases are managed normally by nasal decongestants and saline irrigation, obviously referral to the ENT surgeon, and if at all, God forbid, the patient becomes pyrexic, that means the infection is so huge that the patient starts developing fever-like symptoms, we start with antibiotics. The main thing is to define the cause, find it, and then treat it. So if at all anyone comes across this kind of a problem where they're feeling that there's a lot of pain here, there's a lot of headache and everything, and there was initially some sort of pain in the teeth, you might want to get a consult with the ENT as well as the dental surgeon to maybe come to the conclusion that it was odontogenic, that means it was dental in origin. Conversely, obviously, if it is causing you pain around the teeth and you don't feel that there is anything in particular when you go to the dentist, there is nothing, no sort of periapical pathology, no sort of pulpal pathology, no sort of dental infection per se, and you're still having pain around that teeth, we have to rule out the possibility that this is the kind of close proximity pain of the maxillary sinus. And also we have to be very careful when it comes to planning cases, especially extractions of posterior upper teeth, because if they are very close to the sinus, they can expose or perforate the sinus, thereby creating an oral antral communication which can later form into a fistula that can cause a variety of symptoms and other infections as well. At the same time, when we're planning to place implants, dental implants, we have to see how low the sinus is from the place of insertion of the dental implant, because as the time elapses and you don't have the tooth in the oral cavity, the sinus flow tends to dip down because of the dissolution of the bone, and we have to plan the cases accordingly in order to avoid displacement of the implant into the maxillary sinus. So this was today's episode. Please like, share and subscribe, and please do press the bell icon button for important updates. If you want to do a consultation with me, I'm ready to do it and I'm happy to do it, but please, before calling me directly, please communicate through message or WhatsApp or email to me or on my Insta handles, and I will respond to you. If I don't respond to you instantly, there's probably that I'm occupied with patients or otherwise. And please do subscribe to my channel. Have a nice day.